Hi guys, my name is Xiomara Contreras and I'm a community health worker from Prince George County. I'm here today to talk to you about gastroesophageal reflux disease, better known as GERD.
What is GERD? GERD is a digestive disorder that affects the ring of muscle, the lower esophageal sphincter, also known as LES, between the esophagus and the stomach. In normal digestion, the LES opens to allow food in the stomach and then closes to stop the food and acidic stomach juices from flowing back into the esophagus. Gastroesophageal reflux happens when the LES is weak or relaxes when it shouldn't. This lets the stomach's contents flow up into the esophagus. Some of the symptoms of GERD are as follows: the burning, pressure, or pain of heartburns, bad breath, trouble breathing, a hard time swallowing, vomiting, a lingering cough, laryngitis, asthma that comes on suddenly or gets worse, and sleep problems. GERD has a few risk factors, which some doctors believe include hiatal hernia, which may weaken the LES and raise the chances of gas reflux. Other factors include overweight and obesity, pregnancy, gastroparesis, diseases of connective tissues such as rheumatoid arthritis, sclerodermia, or lupus. One lifestyle is also a big factor in GERD. Some nutrition management behavior that one must keep in mind are to avoid smoking as it will worsen symptoms, avoid food and beverage triggers, including chocolate and fatty or fried foods, coffee, and alcohol, which can cause the LES to relax, eat smaller servings, and to avoid eating too soon before bed as it lets the acid in the stomach go down and partly empties. Having GERD long-term can cause four main effects. Number one, esophageal ulcer. Stomach acid eats away at your esophagus into open sore forms. These sores are often painful and may bleed. The second effect is esophageal strictures, which is when stomach acid damages the lower part of your esophagus and causes scar tissues to form. This scar tissue builds up until it narrows the inside of the esophagus and make it hard to swallow food. The third is Barrett's esophagus. As the reflux changes the cell in the tissue that lines your esophagus, the lining gets thicker and turns red. This condition is linked to a higher chance of esophageal cancer. And finally, lung problems. If reflux reaches the back of the throat, it can get into the lungs during aspiration. If it happens, your voice may get hoarse. If your lung is inflamed, you can also develop asthma, bronchitis, and possibly even pneumonia. You may have heard of GERD from the popular YouTuber Corpse Husband, who rose in popularity during the pandemic by playing Among Us. As a result of having GERD for multiple years, he has an irregular deep voice.